Homeopathy and autism. This is a very important aspect in the treatment of autism. As therapies play an important role, early intervention plays an important role. Use of modern medicine in certain cases plays an important role. Similarly, homeopathy, Ayurveda, these system of medicines have a lot of things to offer to children who are suffering from autism. I will talk per se about homeopathy because I have been practicing homeopathy for the last 25 years and the field of autism for the last 15 years. Autism is a complex neurodevelopmental disorder, and we have seen a lot of good improvement can happen if things are properly planned and the child gets proper therapy, homeopathy, a proper guidance from experts, a proper support from parents and society, a proper care in the school. These all factors are very important. Let us see step by step, like when a small child comes to us, when a teenager comes to us, and when an adult comes to us for homeopathic treatment. So these are various life stages in everybody. So when a child who comes under the age of 5 years, we work on his cognitive skills, his behavioral issues, how we can bring the best things out of him, how we can get the language. If the child is able to talk a little bit, how can we help the child to develop the functional language so that the child can communicate. These are the major goals when we are seeing children who are under the age of 5. We have seen a lot of times the child is very hyperactive and there's a lot of complaint from the therapy center that the child is not sitting in one place. So that's one of the reasons why the therapy is not happening properly, and parents are also very worried. Now they are between a dilemma to give medicines from our modern medicine or to give to other pathies. So lot of information and misinformation, all the things are there. But let us see the scenario in India where homeopathy is a properly authorized form of treatment, where experts undergo a rigorous study for 5.5 years in a medical college after the 12th standard, and they are registered in their what you call medical council, and there's a proper channel for practice of homeopathy. So homeopathy is a safe and it is an authorized mode of treatment in India. And not only that, homeopathy is the second largest system of medicine which people turn to for their treatment options. But autism being a complex disorder and not much literature is there. Nowadays, a lot of literature is there. But what to do when a child is suffering from autism, that authenticity is not yet there. So, but in the last 15 years in the field of autism and homeopathy, we have seen it is very important not only to give the medicines, but to understand the child and what medicines in homeopathy can be beneficial. Along with medicine, a proper formulation of therapy is also very important. We just cannot say that only homeopathy has to be given and there is no need for therapy. A lot of people claim and say that we can cure autism and we can do this and we can do miracles. But let us be very clear that autism is a disorder and the question of curing it is not there. We want to help children who are on autism to achieve whatever best they can and see that they can lead an independent life and excel in their personal life and professional life. So the moment people think that we want to cure autism, a lot of problems start, because after some time the reality comes that this is very complex and things are not going as per they want it to go. Even though we see a lot of positive changes in children happening, they are developing very well, but they are thinking much ahead of time, which is a very big risk when you are handling a case of autism. So one has to be very realistic and one has to be very positive and be realistic about what are the developmental milestones of the kid at that specific age and what your child is having. So let us see what homeopathy does in this scenario. Suppose a child comes to us who is not responding to his name, who is not giving eye contact, who is not sleeping well, who has a lot of issues with the gut, who is hyperactive and runs from one corner to another. He may be also violent. So let us study in cases of eye contact what we do. When a child comes to us, we study the child, and there are various medicines in homeopathy which can work in these areas. And what we in homeopathy work as a holistic way. We do not say that we are going to treat only the cognitive aspect, we are only going to treat the sleep aspect, or we are going to treat the hyperactivity aspect. No, we are going to work holistically. Like, we take the whole case, understand the child, what are the problems, and then the constitutional medicine, the medicine that suits that individual, is given. Now, this medicine has the capacity to increase the eye contact, increase the response to the name, increase the overall understanding, and even bringing out the speech. But this doesn't happen overnight. We have to give time and we have to be patient. That doesn't mean that we have to wait for eternity for the medicines to act. So, within the first 1.5 months time, we see small changes happening with the child, positive changes. So these should be made note of and should be told to your homeopath who is treating, so that he gets a better idea what is happening after the treatment. And homeopathic medicines have been proved on healthy individuals, and there are proper books, pharmacopoeias, where all these things are listed. So this is a properly formulated mode of treatment, and it is completely safe, and it is not drug dependent, means it will not cause drug dependency. Suppose after 6 months or 1 year or 2 years you want to stop the treatment. Now the fear is that will the child come back to the stage 1 if we stop homeopathic medicine? The case being, if you stop homeopathy, it will not go back. Whatever improvement has happened will stay, because homeopathy works in a curative manner. But we are not talking about cure, but we are talking about whatever has achieved by the body will not go back, because we are helping the body to take care rather than just putting a temporary suppression. We are not doing that. We are helping the body to heal. So in these cases, homeopathy in the long run has been very beneficial. Unless and until the child's understanding and processing of the thoughts and expression doesn't come, it is always going to be very challenging. There are drug pictures, what we call in homeopathy, where complete expression of this type is mentioned, and we have to see what remedy comes closest to the individual which we are treating. A proper follow-up every month has to be given for the doctor who is treating you, and we have to work as an integrated approach. Not only homeopathy, but we should also keep a tab on what therapies are going on, what are the goals the therapist is achieving, what is the nutrition the child is getting, what are the external factors that may be affecting the child. Sometimes the parents may be overly aggressive towards the child, sometimes they may be beating the child out of frustration. So all these external factors also have to be taken into consideration when we are treating a child who is on the spectrum.